How do superbugs threaten human health? Imagine bacteria and fungi as tiny living creatures that usually help us or stay harmless. But sometimes, they change in ways that make them very dangerous. These are called superbugs. They are microorganisms that have become resistant to medicines like antibiotics. This resistance means the usual drugs no longer work to kill them. It is like trying to stop a fire with water that no longer puts out flames. Superbugs develop resistance in a few ways. Bacteria can naturally change their genes over time, especially when exposed to antibiotics. If antibiotics are used too often or wrongly, bacteria get a chance to adapt and survive. This makes infections harder to treat. Some common superbugs include methicillin-resistant Staphylococcus aureus, which is often called MRSA. Others are carbapenem-resistant Enterobacteriaceae, or cray, and fungi like Candida auris. These are tough to fight because they don't respond to standard medicines. When superbugs infect people, the results can be serious. They can cause infections that are more severe and harder to cure. For example, MRSA can lead to dangerous skin infections, pneumonia, or infections in the blood. People with weak immune systems, like the elderly or those with long-term illnesses, are especially at risk. Because these infections are harder to treat, they can lead to longer hospital stays and even death. Doctors often have fewer options when fighting superbug infections. They might need to use stronger or more expensive medicines, which can have worse side effects. Sometimes, there are no effective drugs left, making treatment very difficult. Superbugs also spread easily in hospitals and clinics. When patients undergo surgery or have medical devices inserted, they are more vulnerable. If proper hygiene isn't maintained, these tiny organisms can quickly infect others. Preventing superbug infections is very important. Using antibiotics only when necessary and following the doctor's instructions help slow resistance. Good hygiene practices like washing hands often are simple but powerful tools. Vaccines can prevent some infections, reducing the need for antibiotics and lowering resistance risks. Scientists are also working hard to develop new medicines and treatments to stay ahead of these resistant microorganisms. Understanding how superbugs develop and spread helps us protect ourselves better. Responsible use of medicines and good hygiene are key steps. Staying informed about these threats encourages everyone to take part in stopping the rise of superbugs. This way, we can keep ourselves and others safe from infections that are becoming harder to treat.